Hi friends, I'm Dr. George Michaelia. Today my subject is viral infections. Three things I'm going to discuss today. One thing is commonly people called a chicken pox, which is caused by varicella zoster. Second thing is because of chicken pox, the secondary infection which leads into herpes zoster. That is because reactivation of the virus. Third thing is called herpes huminis. That is called herpes simplex. And one of the very commonly thing we call molluscum contagious, very commonly seen in the children's. First, I would like to tell you why it causes. What is the root of cause? First root of cause is direct contact. Virus get entry to the skin layer to the dermis due to the microscopic injury. Once it start get into the, it enters through the nerve segments. It can get into the bloodstream and try to cross through the blood-brain barrier. Second, by direct exposure, okay, otherwise sexual exposure, it get contaminated. Once it get auto inoculated, that's called, it spreads from one part of the body to other part of the body. Now let us come to the chickenpox virus. As I said, it completely because direct exposure, it has got a 9 to 23 days of prodromal period. So it starts with the usually vesicle formation, okay, tensed vesicles, which may get rupture in a 2 to 4 days time, and along with the prodromal symptoms of any fever, malaise, and erythema, and it gets ended with the scar formations. So this usually followed by once the person get the chicken pox, the second phase they is likely to get the herpes zoster, because the particular herpes, the virus which gets lodged in the ganglion roots of the nose. So because of unknown factor, the reason is not known, it get reactivated. Again, the tense vesicles are formed, one segments of the nose, the single nerve segments. So that causes the severe pain. So that develops the one of the very important complications called post-herpetic neuralgia. That remains for a long time. And third viral infection is called herpes simplex. It is usually caused by herpes huminis. That is usually two types. It's usually seen in the face, trunk, and genitalia. It has got two things. One thing is primary and secondary recurrent. There are chances of getting recurrence also. See, primary aim of the treatment is very simple. One thing is, in order to gain the permanent immune support, that is like to confirm the long-lasting immunity. So homeopathic medicine has to improve the cell-mediated immunity. That is nothing but improve the nuclear cells. So it will prompt in action of the cytotoxic action in the because of the antigen antibody complex, by forming the antigen antibody complexes. Second very important part of the treatment is virus should not cross the blood-brain barrier. So it may cause the cell destructions and it may cause the muscular paralysis. Third thing is, in order to gain the viral antibodies in the body, so person need to take a lot of homeopathic medications. It is not the medicine you take to one day and leave it for 3-4 weeks. So one thing is drug of choice homeopathic medicine we call verulinum. Second thing is, according to the prodromal symptoms, like the person depends on the papules, vesicular formations. There are few drugs called Rastox, ranunculum bulbosum, few constitutional medicine, which in turn gives the long-lasting immunity to the particular persons. So that's all for right now. I'll come back to the one most effective suggestion. Thank you.